I think, what you call post-traumatic syndrome disorders. All of these problems are some severe problems within the entire Vietnamese Veterans Organization. Well, not all persons are affected by it, but as a person dealing with people who are faced with substance abuse, what do you do? How do you meet that?
Okay, when a veteran shows up at base camp, they usually are looking for employment. Not always, but oftentimes they're looking for employment. And usually there's some reason why they're not working. And quite more often than not, it may relate to substance abuse. It may relate to post-traumatic stress, or it may just relate to an attitudinal problem. And one of the things that we do at base camp is, rather than just giving a person a list of places where they're hiring, is that we work with that person as an individual, possibly for the first time since his discharge more than 15 years ago, and help him work through whatever precipitated those attitudes. We help him take a look at his personal habits from a drug and alcohol usage standpoint, and we deal with any stress disorders and whatever ramifications that may have had on his personal life.
What are some of the stress disorders, Mr. Deering, that we are talking about?
Well, we can talk about symptoms. I think it's what you're probably looking for. The classic example of some of the symptoms for post-traumatic stress would be a person experiencing nightmares, having a hard time making friends, a rather nomadic individual in that is not settled down. He's gone from Tennessee to Arizona to Florida to New York to Michigan to just all over the country with just no real sense of purpose in life. They could have flashbacks. They could be walking down the street and they hear a loud noise, and then all of a sudden it brings up as if they were right in the combat situation. We see this not only in Vietnam veterans, but we have World War II veterans and Korean veterans that have experienced the same thing. They just had a little bit different nomenclature, a different title for the particular syndrome, but it's the same thing, basically.
Now, these are the problems that your organization is attempting to deal with.
Right. We do this through counseling. There's other methods through medicines, but we found that through counseling and group therapy that we've been the most successful, not only at base camp, but the Vet Center program has been, that's the way they basically attack that problem, too. And
you believe that base camp is in a better situation to handle this kind of problem and to deal with that kind of problem than perhaps the Veterans Administration?
Insofar as we do not have the stigma of the government on our back, insofar as some veterans may look at us, we are totally independent. We are veterans who have experienced either alcohol problems or have experienced unemployment or who have experienced post-traumatic stress firsthand. It's not something that we read out of a book. Now, for those persons that have PTS, what I call the 32nd order, they have a real extreme case. And something that we can't handle naturally, we're going to have to refer that individual to someone who can address that particular situation.
But they actually feel much more comfortable working with your organization than they would with the federal government.
Right.
We've got about a minute before our break, and one thing that we want to talk about, especially after the break, is the entire effort to dedicate the memorial that was recently built for the war period. And we're going to pause here now for a Black Profile series, and we'll be back in about 45 or 60 seconds.